Welcome back to the lecture series on periodontics. Today we are going to talk about two important terms, clinical attachment loss and clinical attachment level. Before we dive into these terms, let's start with the foundation, dento-gingival junction. So what exactly is this junction? Dento-gingival junction is simply an area where the gingiva is attached to the tooth surface. So this is a very small area, but it is very crucial. Why? Because this junction is acting like a barrier for protecting the deeper tissues around the tooth from the bacteria and other harmful agents. Now, dento-gingival junction is made up of two parts, epithelial attachment and the connective tissue attachment. So again, we have epithelial attachment like a seal and connective tissue attachment like an anchor. So together they make up the dento-gingival junction. You might also hear the term supracrestal tissue attachment when we talk about the height of this dento-gingival junction. So this height was previously known as biological width and now it is known as supracrestal attachment, and the height is around 2.04 mm. So this is about the dento-gingival junction. Next, let us talk about the clinical attachment loss. Clinical attachment loss is the amount of the downward or the apical movement of the dento-gingival junction. So in the healthy teeth, the dento-gingival junction is placed coronally. So this is the position of dento-gingival junction in the healthy teeth, whereas in the diseased teeth, the dento-gingival junction has moved down on the tooth root. So the clinical attachment loss is measuring how far this movement has gone. So clinical attachment loss tells us how far the attachment level has migrated down the tooth root, usually because of the disease. How is it measured? Now, to measure the clinical attachment loss, we need a stable reference point. The most common one is the cemento-enamel junction. This line is where the enamel on the crown meets the cementum on the root. So cemento-enamel junction is a fixed point on the tooth which makes it a reliable reference. If the cemento-enamel junction is not visible, like if it is worn or if it is covered with a filling, we can use another fixed point such as restorative margin, like a filling edge. So why do we measure the clinical attachment loss? It helps us to understand the extent of the tissue loss due to the disease. So it is helping us to understand the extent of the tissue loss due to the disease. So now the clinical attachment loss will tell us how much the dento-gingival junction has moved down from its original position. It's a great way to assess how much damage has occurred and whether treatment is needed. To sum up, clinical attachment loss gives us a picture of the past disease progression. It is giving us the picture of the past disease progression. It tells us how much the tissue we have lost over the time. So we take this measurement during the examinations to assess the periodontal damage and to see if the treatment is needed. Next, let us look at the clinical attachment level. So if the clinical attachment loss tells us how much the tissue has been lost, the clinical attachment level will tell us where the dento-gingival junction is on the tooth surface. So clinical attachment level is the most coronal point where the dento-gingival junction is the tooth surface. So to assess the clinical attachment level, we look at the attachment level on the tooth. For example, is the attachment level on the coronal third or on the middle third or on the apical third of the root? So this gives us a baseline for where the dento-gingival junction is right now. So clinical attachment level is useful because it helps us to know the current position of the dento-gingival junction into the
Location.
tooth surface. This measurement is usually taken at the start of the examination or before any treatment to establish a baseline. So, here is an important point. If the clinical attachment level is moving downward or apically, it indicates attachment loss. If the clinical attachment level is moving upward or coronally, it suggests attachment gain. So monitoring clinical attachment level over time tell us if the attachment is getting worse or getting better. In simple terms, clinical attachment level gives us the starting point or the current position of the dento-gingival junction on the tooth surface. Whereas, on the other hand, clinical attachment loss tells us how much this attachment has moved down due to the disease. So, these measurements are vital for diagnosing the periodontal health, monitoring the progression of the disease, and guiding the treatment decisions. So, remember, clinical attachment level gives us the current position of the dento-gingival junction on the tooth surface, and whereas the clinical attachment loss shows us how much attachment has been lost. Both are important for assessing periodontal health and determining if the treatment is needed.
If you found this video helpful, hit the bell icon below and subscribe to my channel, and stay tuned to Tooth Fairy Tales for more dental videos.